Hello there. Today we will be performing a full head-to-toe assessment. I have my patient here, Lucy. She's a 25-year-old female, and she's nice enough to let me do the exam today. All right, are you ready, Lucy?
Yep.
Great. If you have any questions throughout this, just let me know. I'm here to help, okay?
Okay.
All right. So first of all, just noticing her appearance. She looks calm, no active distress. She's well groomed. Yeah, so we're going to get started. So first we're going to do the cranial nerve assessment. So I'm going to ask you a couple things. So we're going to defer the first cranial nerve, but the second cranial nerve. I'm just going to look in your eyes here. I want you to look straight over my shoulder here.
And the lights are dimmed.
And the lights are dim, thank you. My lovely assistant. We left the lights on so you can see us better. All right. Okay. So pupils are brisk, perla, culminating to light. So that has cranial nerve 2 and 3. And then I want you to follow my finger. Good. Good. Movements in all quadrants. So that's cranial nerve 3, 4, and 6. And then I want you to puff out your cheeks. Give me a big smile. Shrug up your eyebrows. Good. All right, so that's cranial nerves 5 and 7. Does this sound the same in both ears?
Yeah.
Okay, cranial nerve 8 is intact. Then I want you to stick your tongue out. All right, and go ah. Good. All right, so that was cranial nerve 9, 10, and 12. And then I want you to shrug your shoulders for me. All right, and you can relax now. Cranial nerve 11. All right, so now we're going to go through some things on your head. So first, I'm just going to notice the appearance of her hair. Good hairline, no hair loss, and no signs of any lice or other abnormalities there. And then I'm going to inspect your ears here. So first, I'm just going to note both sides. They have equal symmetry on both ears. The pinna auricula is all intact on both ears. Next, I'm going to inspect the inner portion of your ear. Let me just switch this out for 1 second. Sorry. Okay. All right. These are falling off here. Okay. All right, so I'm going to pull your ear up and back. We're going to just look inside there. All right, so you can see there's some slight cerumen. We're having all sorts of technical difficulties here. We're going to look at your other ear, up and back. Your tympanic membrane has some scar in there. Did you have a lot of ear infections as a kid?
Yeah.
Okay. All right. And while I have this on, let's look at your ears too. So yeah, so some scarring on your tympanic membrane. Otherwise, no drainage or anything in your ears. I want you to tip your head back for me.
Mm-hmm.
Okay, I'm just gonna look. Okay. There is some redness underneath your nose, some skin breakdown, and you mentioned you've had a cold.
Yeah, I've had a cold this week. So.
Okay, so normal breakdown there. A little stuffiness, congestion, but nothing else abnormal noted there. We're going to look at your eyes.
Okay.
We kind of looked at those earlier, but we're going to look specifically at your your pupil. Okay, all right, so as I'm looking into your eye, first of all, I observe that there's no abrasions, no redness, cornea and sclera intact, and then I can visualize the optic nerve because I'm that good. And yeah, there's a red light reflex as well. So that's all good news. Okay. Next, I want you to open your mouth nice and big. Okay. And say ah. Perfect. You know the drill. I'm going to use this tongue depressor. Just kind of push down your tongue so I can get a better view. Go ahead and open your mouth. Okay, so I'm visualizing the back of her throat. She definitely has inflamed tonsils, but she has been sick this week, and some like slight redness, otherwise pink and normal. Oral pharynx, it's all normal in appearance besides that. And show me your teeth. Good dentation. No abnormalities noted there. And then I think I mentioned this, but her face is symmetrical. Next, I'm going to palpate. I'm going to feel all of your lymph nodes.
Okay.
Submental, submandibular, preauricular, postauricular. Okay. Your anterior and posterior cervical lymph nodes and your supraclavicular. All right, and those all feel good. Oh, and your tonsils as well, which are inflamed, as I mentioned. So those are all a little puffy from being sick. All right, now I want you to bring your neck down and bring it back all the way. Move from side to side. Any pain or tenderness?
Nope.
Okay, so a good cervical movement there. And then I'm gonna just feel here. I want you to swallow for me. Good. Trachea is midline. And then I want you to swallow again. Okay. So I'm able to inspect it, and everything is normal there. Let's see. I'm trying to make sure. Oh, one other thing. I want you to touch your nose, your finger to your nose, and then touch my finger. Good. And touch it again. Okay. And then do it with the other hand.
Do it with what?
You do it with the other hand now. Good. Great. So great proprioception. And then I want you to run your left shin, your left heel along your right shin. Good. And do the same on the other leg. Perfect. All right. Good movement there. And then let's move on. We're going to do assessment of your lungs and your chest. Okay. So go ahead and scoot forward just a little bit for me. Okay, so we're going to start with the lungs. Just as I'm looking at her, she's got a normal respiratory rate and pattern. She does have a cough. Like I said, she's had some congestion.
Yeah.
And then we're just going to listen to the different lobes, okay? Normally I would do this on the skin, but just for privacy, we're not going to. Okay, go ahead and take a deep breath for me. Good. Another one. One. We're over here. More in the middle. One more. Okay. Alright, now I'm going to listen on your backside. Go ahead and take a deep breath. Again. Great. One more. One more down there. And again. And last one. Excellent. Okay. So, lung sounds are clear. No abnormal breath sounds were noted. Yeah, and her skin coloring looks good. No, she's not blue, not gasping for air. So, good. All right, so now we're going to listen to your heart. Okay. So first we're going to listen to the aortic point. Take it, just breathe normal, okay? Pulmonic. Tricuspid. And then the mitral. Great. S1 and S2 are both present. That's normal heart sounds and no murmurs, rubs or anything. I'm gonna listen to your neck now.
Okay.
We're gonna see if you have any carotid bruits. So I'm gonna flip over to my bell here, and just hold your breath for me. Okay, no bruits heard. Okay, excellent. And now we're gonna do a peripheral vascular exam.
Okay.
So I'm just gonna check your radial pulse here. Okay, that's +2. And as I'm doing this, I'm noting her skin color is normal, her nail beds look good, no edema is present. Same goes for her feet. I'm gonna palpate here for her dorsalis pedis, they're +2. Posterior tibials +2. And then just lay back against the couch for me. And then I'm just gonna assess the femoral arteries, and those are +2 as well. All right. Okay, excellent. We get no edema noted on that. We are going to move on now to the musculoskeletal section of the exam. Okay. So I want you to put your arms up like this. Okay. I want you to push against me, push down. Okay. Push against, push back, push forward. Okay. All right. Squeeze my hands. Just resist. Okay. Good. She's got equal strength, active range of motion in her upper extremities. I want you to push down on my hands with your feet. Good. And lift up towards the sky. Good. Okay, I want you to push up against my hand and push up here. All right. Kick out. And again. Okay. And pull in. Pull back. Good. Okay, so equal strength in her legs as well, and active range of motion is great. I want you to lean forward. We're going to assess for CBA tenderness. I just want you to tell me if this is painful.
No.
Okay, great. All right, now I'm going to have you stand up.
Okay.
We're going to have you, maybe have you come to the side over there. Okay, so I want you to walk just straight towards me. Okay, and then I want you to walk back, heel to toe. Okay, great. Excellent. So she's walking normally, good gait, balance, and yeah, no abnormal gait there. Go ahead and come back over here towards me.
Okay.
I want you to turn around. I want you to touch your toes. Okay, and I'm just going to palpate your spine here. All right, so she has good curvature of her spine. No abnormalities there. I want you to just twist for me. Okay, any pain, tenderness. Okay, good. Lumbar movement. All right, and then go ahead and sit down for me again.
Okay.
Okay, so now we're going to do 2 special tests. The first one, I want you to put your hands together. Okay, and you're going to hold it for 60 seconds. All right, we're going to hold it for 60 seconds. Any pain?
Nope.
Okay, perfect. And this is just testing for carpal tunnel, which looks like you're doing well. Then I want you to just lay back under the pillows there for me. All right, perfect. Okay, and we're going to test to see if you have an ACL tear. Okay, so I'm just going to support you here. I'm just going to push. Any pain?
Nope.
Great. One over here. Any pain?
Nope.
Okay. All right. That's a Lakeman test. So that's normal. We're going to assess now your abdomen.
Okay.
So why don't you just lay flat for me? Just roll your shirt up a little bit.
Yeah.
Thank you. All right. Okay, so first I'm just going to inspect the abdomen. It doesn't appear to have any bulges, lumps, any redness, or any other issues there. Next, I'm going to auscultate the 4 quadrants. All right. Just relax for me. Okay, she has normal bowel sounds. I'm also going to listen to see if she has a aortic bruit, which she does not have. And then next I'm going to percuss in the 4 quadrants. just all over the liver and the spleen. Okay, and then I'm going to now lightly palpate and then deep palpitation. Okay. Great. Any pain there? Okay, so there's no pain noted, which is great. When I was percussing, there was no hyper resonance or dullness. Sounded normal, and everything feels good out there. So no enlarged spleen or liver.
Sounds good.
Okay. So now let's have you sit up for me again. I kind of forgot to do this earlier, but we're going to check your reflexes, okay?
Okay.
All right, so first we're going to check your bicep reflex. Good. And then your tricep. Good. And your brachioradial. Perfect. And your patellar, I'm just going to try to just relax. Good. And then we're going to take your foot up here. And great. Your Achilles tendon is got a great reflex there. I just did it on the one side. Do it on both. But let's see here. I think I've covered everything.
Do you need to do the...
Oh, yes. Let me check. See, I have my lovely assistant. All right. Does this feel the same on both sides?
Yeah.
Okay. I'm just going to use my nail. I want you to close your eyes.
Okay.
Do you feel sharp or dull?
I feel your nail.
Okay.
Sharp.
Great. How about now?
Sharp.
Okay. How about now?
Dull.
Okay. Same thing. Keep your eyes closed.
Okay.
Sharp or dull?
Sharp.
Okay. How about now?
Dull.
Okay. Does it feel the same on both legs?
Yeah.
On both arms it feels the same?
Mm-hmm.
Okay. Great. Okay. All right. Well, thank you for being my patient today.
Sure thing.
You did excellent. Thank you, guys. Till next time.